Good evening, everyone. Yeah, quite delighted to have you guys today. We have Dr. Upali Peris, who is a psychiatrist, and Dr. Wasantha Weliange. He does advocacy for cannabis. And yeah, we were expecting Dr. Manoj Fernando, who is a uh, who is an expert in addiction medicine, but unfortunately he has a family commitment. And he has sent me a small note, and he says that he tries to join on his way. Still, uh, we can wait for him until he joins. So my name is Dr. Ruwan M Jayatunge. Uh, First of all, I would like to do this presentation, and then we can talk about pros and cons of cannabis, and what are the positive effects of cannabis, or what are the negative effects of cannabis, whether it's a good recreational element or it's harmful. So I hope everybody can see my presentation.
Yes.
I can see.
Can you see the slides are moving? Do you see the second slide?
Yes.
Yes.
Excellent. So,
Yes. Yeah.
as you know, cannabis, marijuana has been used throughout the world medically, recreationally, and spiritually for thousands of years. And it has over 400 chemicals. And one fact is cannabinoids effect on human brain regions involved in cognition, memory, reward system, pain perception, and motor coordination. And it can produce euphoria, perceptual alterations, time distortion, and other effects on the user. And it's very important to highlight that cannabis smoking shows a dose response relation with pulmonary risk in the same way that tobacco smoking does. And long-term cannabis use can cause depression, paranoia, learning problems, memory deficits, and attention deficits. And there's a link between cannabis and suicidal ideation. There are research done by a number of experts, and cannabis intoxication can cause social withdrawal, alienation, and impaired judgment. Also, we have identified this specific condition. I think our Dr. Upali Peris, who's a prominent psychiatrist, would highlight this factor, cannabis motivational syndrome. And people who is affected by cannabis motivational syndrome, they have lack of drive, lack of energy, lack of motivation, poor self-care. And I have seen number of patients in my clinical practice. And also cannabis intoxication, it can produce psychosis, which we call cannabis-induced psychotic disorder. So research indicate that cannabis use is a risk factor for the development of incident psychotic symptoms. So I would like to mention here a case study. This patient that I treated somewhere in 2003. This patient was referred to me by Dr. Manoj Fernando, psychiatrist, for psychological management. This young guy who was 22 years old, very bright student, he was sent to England to do a management degree in a very prestigious university in England. So he stayed with some students from Caribbean region, and they used to smoke pot. Like it's a sort of in Caribbean region, they call it kaya, and they often smoke it. Some of these people, and it's connected with reggae music. So this student, Sri Lankan student, started smoking a joint once in a way. Then somehow he got hooked to this cannabis, and gradually his mental health started fading. He started experiencing brief psychotic episodes. He couldn't concentrate. He couldn't finish his degree. And then he had to come to Sri Lanka. Then the parents took him to Dr. Neil Fernando. Dr. Neil Fernando started treating him with risperidone. And also he wanted me to do counseling and psychotherapy for this gentleman. And it took us nearly 2-3 years to bring him back to his senses. So this is one of the case studies. And I have, over the years, I have seen number of patients in Sri Lanka, in Canada, and in other parts of the world who were affected by cannabis use and gone into sort of cannabis amotivational syndrome, cannabis-induced psychosis, sometimes schizophrenia, etc. So a lot of people say that cannabis has some form of creativity. And so we don't know whether creative people, they smoke cannabis or cannabis enhances creativity. But the evidence is not conclusive. There is no proper indication for that. And we know that, like, Snoop Dogg, Lady Gaga, Miley Cyrus, they smoke pot, and they say that it gives them sort of a kick. But this is my opinion. If I'm wrong, Dr. Upali Peris, you can correct me. Cannabis, it produces certain euphoria, relaxation, and intensification of ordinary sensory experiences. So we tend to think that this is a sort of an avenue for us for creativity. Probably that sensation, that relaxation, sort of people think, oh, it helps me to create something, it helps me to write a song or write a novel. But in the long term, what happens is their mental state is highly affected. So I can remember like people like Ozzy Osbourne doing pot for decades, but he was doing other drugs too. But now he's in a sort of very mentally and physically vulnerable state. And it's important to know that cannabis use can precipitate schizophrenia in vulnerable individuals. So using cannabis before age 80 may affect how the brain builds connections for functions like attention, memory, and learning. And definitely cannabis affect brain development. So it's bad for the youngsters, it's bad for teenagers. For developing brain, it has detrimental effects. And I have seen that as a person in the psychological field, but I hope psychiatrists have seen hundreds of cases. And there's a relative risk for schizophrenia in adulthood. Also, chronic cannabis use may alter brain structure and function in adult and adolescent population. And also bad for the pregnant women because it affects fetal growth trajectories, and especially low birth weight. It can cause, there's a risk for low birth weight if a mother smokes a pot. And heavy cannabis use may contribute to the development of significant psychosocial and health-related problems. Especially acute cannabis use significantly increase the risk for car crashes. In 401 in Canada, in Toronto, I had two bad experiences. Two drivers who were smoking pot, they nearly killed me while I was driving. So I had a bad experience with it's alcohol. I don't know. It's if they are inebriated, you can see, but especially with cannabis, it's very difficult to detect, and you have to do the urine test for that. So and some people, they can smoke marijuana and they can drive. They think it's safe, but there are a lot of accidents. So I faced two car crashes merely because of the impaired drivers. So there are a number of adverse effects of marijuana on the developing brain. And it's a detrimental effects on cannabis during adolescence because there are connectivities. It affects neuron and it affects their intelligence, attention, learning issues, and executive functions. So psychiatrists point out a number of dysfunctions associated with cannabis abuse, like apathy, sedation, disinhibition, psychomotor retardation, impaired attention, impaired judgment, poor self-care. You've seen a lot of people with poor self-care. A lot of pot smokers. You see, especially homeless people doing a lot of pot in North America, and it somehow it goes hand in hand. So long-term marijuana smokers are at risk of worse respiratory symptoms and more frequent chronic bronchitis episodes. And it has the risk of developing schizophrenia and other psychosis. Because marijuana can cause THC-induced cognitive impairment. So these are the toxic effects of THC: extreme confusion or anxiety, paranoia, panic attacks, delusions or hallucinations, severe nausea, and vomiting. So THC can cause changes in mood, thoughts, and perceptions of reality. Smoking marijuana can potentially more dangerous than other forms of use, because now we know it comes as candy, it comes as brownies, sometimes it comes as cannabinoid oil form, and even comes as jujubes forms I have seen. But smoking, it's more detrimental. So it's important to note that about 10% of people who begin smoking cannabis will become addicted, and 30% of current users meet the criteria for addiction. So being said that, nowadays there's huge talk about cannabis, medicinal marijuana. So some people think that it's safe, it's a safe drug, it's better, safer than alcohol. And a lot of people are using medicinal marijuana. We're going to talk about that. There's a big difference between street marijuana and medicinal marijuana, because medicinal marijuana is highly purified and lab-made versions. So especially people, they get misled by that. So they think street marijuana is something harmless. This is like, why can't I buy from the street? Because it's the same, but it's not the same. It's two different versions. So the use of cannabis for medical purpose is a controversial but an important topic. And also it has a public and scientific interest. So there are a lot of research. I have to admit that there are a number of research have done recently. So medicinal marijuana has been prescribed in chronic pain management, anti-epileptic treatment in partial epilepsy, symptomatic relief in multiple sclerosis, and chronic neuropathic pain. Also, it has positive effects to reduce symptoms of nausea and vomiting when you give chemotherapy, because the patients suffering from cancer, when they undergo chemotherapy, the huge problem is vomiting and nausea. So using cannabis-based medication help to reduce their nausea and vomiting. So some people use cannabis to treat health conditions, including epilepsy and multiple sclerosis. And especially, there's a study that was done in 2018, found that CBD oil reduced seizures by 39% in children with Dravet syndrome. Dravet syndrome is a form of epilepsy in childhood. So it helped these children who were having epilepsy. I think I saw some years ago a program done by CNN by Dr. Sanjay Gupta, and he mentioned about the therapeutic use of cannabis. But It's important to know that CBD oil does not contain THC. So cannabinoids could slow a tumor growth in different cancer models. So in a way, we can use cannabis, uh, these cannabinoid chemicals to treat cancer. So there are some evidence that medical marijuana might it improves sleep in short term for people with obstructive sleep apnea, pain reduction in fibromyalgia and multiple sclerosis, increased appetite and decreased weight loss in people with HIV and AIDS, reduced tics in people with Tourette's syndrome, reduced anxiety in people with social anxiety disorder, improves symptoms of post-traumatic stress disorder. Because my specialty is PTSD. So in the latter stages, because I've been working with some of the experts with veteran administrations, and especially the Iraqi veterans and the Vietnam veterans. Lately, they were treated with cannabis. Some of the medication contained cannabis, and there was sort of positive outcome, but still it's under research stage. So but what I want to highlight is cannabis may be having some therapeutic effects, but it should not be a recreational drug. That's my stand. And we'll talk about legalization and decriminalization of cannabis, especially in Canada. They legalized the recreational use of cannabis in 2018. And there was a huge controversy from the medical field. Some medical experts, they opposed this. But later on, I spoke to one of the lawyers who were very closely working with Justin Trudeau, and he told me this. He said that in North America, this cannabis trade that was done by the bikers, Hells Angels, these the criminal gang in Montreal. So they were making millions of dollars annually, and that money was going to do criminal activity. So the experts got together. They thought, I mean, why can't we legalize cannabis to prevent these criminal activities in order to hit the Montreal bikers, Hells Angels? They took decision mainly. I'm not telling this is the only reason, but there were other reasons. But there were medical experts who were not against legalizing cannabis. My stand is we shouldn't. I mean, we have to decriminalize all the drugs. That's a different conversation. That's a different lecture or debate we can have, because once you prohibit something, there's an attraction. So my personal opinion, we have to decriminalize. Otherwise, we are putting a lot of energy, a lot of money on law and enforcement, and going behind people smoking pot. So, but it's important to enhance health education. For instance, now cigarettes are freely available. If I go to any store, I can buy cigarette, but I don't smoke. So, but if there is a sort of prohibition, if there is a sort of scarcity, obviously as a human being, I might get a sort of, I would be tempted to try tobacco. So same thing goes to other drugs. What we have to do is we have to enhance health education and treat people with addiction. So this is what Bill Murray has to say. I find it quite ironic that the most dangerous thing about weed is getting caught with it. So that ends my presentation, and I would like to invite the next speaker. So who wants to come? Dr. Wasantha Weliange, would you like to come with your points?
Wasantha gave the host
He was,
facility.
yeah, he joined. He was here. Can you hear me? Or until he comes, Dr. Upali Peris, you mind continue that? If you have a presentation, let me log out. Do you have a
no,
presentation?
I don't have a presentation.
Okay.
No, I don't have presentation. I just wanted to, as a psychiatrist practicing in Sri Lanka, I want to have contribute to your discussion. Actually, Ruwan, you have mentioned all of the medical aspects, right? Almost all the medical aspects with regard to cannabis use, right, among the patients. And now, as a psychiatrist practicing for for last 4 decades or more, I have seen enough young youth is coming with the effects of cannabis, right? And among that, which is more disheartening, is that the students that's adolescents who have taken cannabis in the form of Madana Modake, right? The Madana Modake is a kind of a famous drug which has been an Ayurvedic preparation, which when I was a trainee in Peradini in somewhere in 90s, then they have done the analysis of what it has. They found it has cannabis and athanate. I don't know what is in English that word for athana. It's a kind of anticholinergic action, plus the cannabis, which has been used to make this decoction, or rather the modakaya paste, and then they make it rolled up and packeted. And if you remember, in my age, I remember anybody listening who are in my age in 60s, we have seen the advertisements in newspapers. Srimad Madana Modake, right, is published in newspapers with a man having an elephant on his hand, and he's raising elephant. So that kind of thing. For youngsters, used it, and I asked in some of the people who have used mother mode care, has said that it will give them a sexual pleasure when they masturbate, right? And then that is for that they have taken, and it also delay the ejaculation, and as such they have consumed that. What the outcome was that finally they end up in severe acute psychotic episode, which with the paranoia and the depression, emotional significant emotional content on that. So therefore, and then they are being brought to the psychiatric units by the parents, right? And mainly that happens during the big matches, the cricket big match season. They bring and then they consume in openly, sharing with the other students. These are the periods that they are vulnerable, and they are mainly adolescents, as it has as the research shown. If a youngster who has taken cannabis is more likely to develop psychotic symptoms than in an adult that who has been using cannabis. I think Ruwan very well portrayed in his presentation about that. And people who have any other psychological problems are more prone to develop complications of cannabis. Now, as a psychiatrist, I have seen the effects of cannabis in the context of psychosis, anxiety, panic attacks, and also of full-blown schizophrenia-like disorder. Schizophrenia-like disorder, schizophrenia, by definition, cannabis can't cause schizophrenia, because it's an exclusion in the ICD-10. You have to exclude any psychoactive substances in order to diagnose schizophrenia. But there are the substance induced psychotic symptoms, schizophrenia-like disorder. There's a rubric for that in ICD-10. So it's not really schizophrenia, but schizophrenia-like symptoms, which hallucinations, delusions, and of course they will have agitation. They can become extremely restless and needing the severe uh, uh, the parental treatments of antipsychotics in order to contain their agitation and behavior. That is one side of the presentation. The acute presentations are the one which I have been just talking about when people take cannabis. As Ruwan said, the mainly it's the key component is delta 9 tetrahydrocannabinol, and that is the one which is causing the psychosis and the psychological more effects on the brain, and uh, it is produced in the plant hemp or the cannabis sativa, right? But if you eat the plant leaves, it does not, the raw leaves. You don't get any action because it is in a more it needs to be decarboxylated to get the tetrahydrocannabinol, and therefore when you heat it up or dry it up, then the decarboxylation takes place, and then it is more psychoactive substance, the THC, is being produced in that. So when you when you take in variety of forms, as Ruwan said, that it is available in the in oil form as the plant extract and the resin, right, which has very different names for each of the presentations, and but the oil is having the highest concentration of THC in that compared to the marijuana or the bud of the plant. Then if you take the if you take the long-term effects of cannabis use, that Ruwan also pointed out the amotivational syndrome. That amotivational syndrome is a state where they don't do anything, right? Then they just stay without having any drive or without having any energy in order to pursue on their goals. Previously very energetic, very hyper, very active youth suddenly becoming very withdrawn and doing nothing, refusing to go to his job or refusing to go to school is the outcome of a motivational syndrome on the long term use of cannabis. And there's another rare, but there's another complication of cannabis on long-term use is called cannabinoid hyperemesis syndrome, right? It's a severe condition in some chronic cannabis users where they have repeated bouts of uncontrollable vomiting, which lasting for about a day or two, right? So it is also it's called the cannabinoid hyperemesis syndrome, which when they have severe bouts of uncontrollable, and they can even there's a mortality, and they can die out of that as well after vomiting, right? So I mean, there's a cognitive impairment, there poor concentration in long-term abusers, cannabis. And also there's a cardiotoxicity. They are more vulnerable for cerebral vascular accidents and ischemic heart disease, right? And also they are in men. They also have it affects the sperm count and the quality of the sperms, getting azoospermia or having poor quality sperms which lacking motility that is needed for proper fertilization of the ovum. So therefore, people who chronically abuse cannabis can also have problems related to their sperm count. Any other issues with regard to the psychological issues is the withdrawal symptom, which is characterized with irritability and craving. So they are more psychological, more psychological than physical, and they get an intense craving to get it back again, and they can also be very irritable, insomniac, and they will go for looking. They will go to get some other, find out the substance, and end up there acute withdrawal syndrome. So that happens. It's very often among the people who abuse and dependent on cannabis. So the dependence, when you see it does not happen for everybody who consume cannabis. The research show it's about 9 to 20% of people who take cannabis can become dependent on that. So not that everybody, and there's a genetic and genetic vulnerability. They have done very research on that. The genetic vulnerability really in chromosome 7 and various other chromosomes, which they have found alleles which depict the vulnerability for cannabis addiction in genetic studies. Apart from that, the in Sri Lanka, we have a traditional treatment, Ayurvedic or whatever. They use this as their in their whatever the medical prescriptions. But having said that, how this being used, how they prepare those medications are really something which has been very questionable. Unlike in in Western medicine, that they are prepared in a proper, proper plant or machines with the aseptic conditions without getting any adulteration or adding, but we are not sure how do they make it. But nevertheless, the Ayurvedic department, I think, legally, they use it to make medications. I have little knowledge about it, but only aspects of that was the Mother Modaki, which has been telling. And apart from that, there may be other preparations available in the market, right? Something to enhance the libido. And I have heard about the patients who are telling about people who have sexual dysfunction, has used certain compounds which probably made out of cannabis. So when you are thinking about the sexual dysfunction, is again part of psychiatrist domain, and we have found people using cannabis in order to alleviate their premature ejaculation and also to enhance the libido, right, in the beginning, but subsequently, without their awareness, they leading into either psychotic symptoms such as morbid jealousy. Morbid jealousy is a condition which is very difficult to tolerate by the spouse, that they become extremely suspicious about the spouse, especially if they have erectile dysfunction or sexual dysfunction, and the man will think the woman will go away and or sleep with another male in order to get her desires fulfilled. So the morbid jealousy is a very difficult condition. Even today, I saw a couple in which the morbid jealousy, which is very difficult to treat. But nevertheless, there are effective treatments, but we have to first get rid of the use of cannabis from them in order to have successful outcome. Apart from that, I think Ruwan has covered up most of the other aspects of psychological impact of the cannabis. So therefore, I think we have to. It's interesting to go through that your slides, which I admired it very much, and that's all. Unless you have any question, I can answer to that. But that's the things that I wanted to discuss in this forum today, right? I think Wasantha, maybe they are the other side, and maybe he has something to say about.
That was an
Okay,
excellent
Ruwan?
narration, Dr. Upali Peris. I think it's wonderful. I mean, without a paper, without a slide, because excellent. I know. I mean, I wish I could do that sort of presentation, because it's like everything. I mean, without any interruption, you highlighted key points, and it's a brainstorming. And also, yeah, indeed, you mentioned about Madana Modaka. Not only in 1960s, even now. I mean, the even school children are using Madana Modaka. They think the teenagers, they think like it enhances your masculine power. The weightlifters, they think they get full muscle strength, and also for sexual dysfunctions they use, and sometimes for food, especially for when they cook meat, they think it gives a sort of a good flavor, and I don't know how it affects. And you mentioned about the cannabis leaves, and it has no any toxicity. But I read one of the books written by Bertie Ranjit. He was a rebel who participated in 71 uprising. So when they were hiding in somewhere in Knuckles, so they prepared food, and accidentally somebody dropped cannabis leaves, and he says that they got some high, and some people were excessively sleeping. So
Yes,
that
Ruwan, that
day,
is to say, if you heat or dry
oh,
up the raw, I'm talking about the raw leaf, like
okay,
that it happens in cocaine, that that in the South America, that they have, you don't get that kind of kick up when you eat up the
okay.
raw
So when
leaf.
you heat up, yeah,
Heat up,
that
the
explains.
decarboxylation takes place, the tetrahydrocannabinol can
Okay,
be
that's why they
formed.
were
Yes.
sort of, they got a high, and I mean they were on guard, like the 5 or 6 people. So everybody was
Mm.
it's sort of a hidden camp. This is during the 71 uprising. They were anticipating attacks from the government forces. So instead of be on guard, everybody was sleeping. So this is the effect of cannabis leaves. This is a biography
Right.
written by Bertie Ranjit. And also the other fact I want to ask is, yeah, especially the vulnerability. Yeah, certain people are either vulnerable, they have susceptibility for cannabis, because some people say, I've been smoking pot for my life, like for 20 years, 30 years, nothing happens with me, I'm okay, and I'm more functional. So with I think we can go with the individual cases. We can't say that that guy is doing cannabis, nothing wrong with him. So the person, we can do the same. So as you elegantly mentioned about the genetic vulnerability, so we have to be very cautious about telling that. And the other thing, now with this glorification of our past, some people say, even I have read it on Facebook, our ancient warriors used cannabis. They use the term Triloka Vijaya Patra. So then they got this enormous ability in the battlefield. So and the British forces knew that, and they wanted to sort of stop that, and they made it illegal. I think this is a wrong conception. I don't think the cannabis and the warriorhood, it doesn't go hand in hand. Okay, so our next speaker, Dr. Wasantha Weliange, he does a lot of advocacy for cannabis. He has written several books about this subject. So, Wasantha, would you like to share your ideas?
Yes, now actually I'm representing 70% of the population.
Okay.
Because, so last time when I was with the discussion with Sakya, he said there are like 30% of people born or after birth, they will get psychological problems. And you all people are most of the time dealing with the vulnerable people, not healthy people. So I think I have no any psychotic problem. So therefore I could finish my third book about cannabis development board with 350 pages within last 4 years. And it is based on 550 scientific articles written mainly between 2020 and 2024. Like 75% of the articles from peer-reviewed journals, from Nature reviews, right? From any other molecular biology, biochemistry journals, I collected information about new research. And according to that, cannabis can cure almost all diseases. Cannabis cannot do operations, but it can heal the people in many diseases if you know how to use it. So when you say cannabis, cannabis has mainly many different types. If you say amba varga kiyak apita tiyanawada? Neither. We have many different types of amba. Pol කියපුවාම we have many types of pol. ඊට පස්සේ කාංසා කියපුවාමත් කාංසාවල තියෙනවා ප්‍රභේද රසක්. ඒ සමහර ප්‍රභේදවල THC අධිකව තියෙනවා, සමහර ප්‍රභේදවල THC අඩුවෙන් තියෙනවා. හරි. එතකොට සමහර ප්‍රභේදවල උදාහරණයක් හැටියට ඊශ්‍රායලයේ දැන් මෙඩිකල් කැනබිස් වලට පාවිච්චි කරන කාංසාවල THC 120ක් සහ CBD 20ක් විතර තියෙනවා. දෙකම සමානව තියෙනවා. තායිලන්තේ මම ඉන්න කාලේ මම ගිහිල්ලා කරපු පරීක්ෂණ වලින් මට තේරුණා, දැනගත්තා එයාලගේ ප්‍රභේද 4ක්, තායිලන්තේ ප්‍රභේද 4ක් එයාලා ජාතික උරුම බවට පත් කරා. ඒ ජාතික උරුම කරපු කාංසාවල THC තියෙනවා 12-15 අතර. ඒ අතර CBD එවැනි ඉතා ඉහළ අගයක් තියෙනවා. හරි. එතකොට දැන් අපිට වැරදිලා තියෙන්නේ ඇත්තටම අපි කැනබිස් ගැන විද්‍යාත්මකව ඉගෙනගෙන නැහැ. හරි. අපි ඉගෙනගෙන තියෙන්නේ අපි අහපු දේවල් සහ ඔයාලා විශේෂයෙන් මනෝවෛද්‍යවරු නිසා ඔයාලා වැඩිපුරම හැසිරෙන්නේ, ඔයාලට තොරතුරු වෙන්නේ ඔයාලගේ රිසර්ච් වලට පාදකෙක් කරන ඔයාලට 100% ඔයාලා රිසර්ච් එක කරලා තියෙන්නේ වල්නරබල් මිනිස්සුත් එක්ක. වල්නරබල් කියන්නේ එක්ක උපතින්ම එහෙම නැත්නම් පසුව මානසික අසනීප තත්වයකට පත් වෙච්ච අය වෙන්න ඇති කියලා මට හිතෙනවා, මම දන්නේ නැති නිසා ඒ ගැන. එතකොට එතන විශේෂ දෙයක් තියෙනවා. එතකොට මම සෞඛ්‍ය සම්පන්නයි කියලා මම හිතනවා. හරි. මම තාම පොත්පත් ලියනවා. මම මේ ළඟදී දැන් මේ ට්‍රාන්ස්ලේෂන් එක කරමින් ඉන්නේ. මගේ 3 වෙනි පොත ඉවර වෙලා ත්‍රිලෝක විද්‍යාපිට මම ට්‍රාන්ස්ලේට් කරනවා ඉංග්‍රීසියට. හරි. ඒ ඉංග්‍රීසි ට්‍රාන්ස්ලේට් කරනකොට මම අලුතෙන්ම තොරතුරු කියවනවා අලුත්ම රිසර්ච්. එතකොට මට තේරෙනවා මෙහෙම දෙයක්. ඇයි ලෝකයේ දියුණු රටවල් කංසා තහනම අයින් කරලා කර්මාන්ත සඳහා වෙනමත් ඖෂධ සඳහා වෙනමත් ආශාදය සඳහා වෙනමත් කර්මාන්ත 3ක් එයාලා ඇයි එහෙම කරන්නේ? එතකොට අපි දන්නවා ලංකාවේ ළමයි වැඩිපුරම ඉගෙන ගන්න යන්නේ කැනඩාවට. නැත්නම් ඇමරිකාවට. හරි. මේ රටවල් දෙකේම කැනඩාව නම් හැමතැනම කංසා නීතිගත කරයි. නීතිගතයි. හරි. එයාලට අරන් බොන්න පුළුවන්. හරි. ඊට අමතරව ඖෂධීය කංසා වර්ගත් කර්මාන්ත සඳහා වෙනම භාවිත කරන එකක් තියෙනවා. හරි. එතකොට ජර්මනියේ ගිය අවුරුද්දේ ලීගලයිස් කරා කංසා බීමත් අනිත් ඒවා කරලා යාලා තිබ්බේ. අවසානයේ තමයි ආශ්වාදය සඳහා කංසා භාවිතය සඳහා නීති රීති සකස් කරන්නේ. එතකොට එතකොට යුරෝපයේ බොහෝ රටවල ආශ්වාදය සඳහා කංසා නීතිගත කරලා නැති වුණාට ඒක බොහෝ ඩික්‍රිමිනලයිස් කරලා තියෙනවා. එතකොට ඒ භාවිතා සඳහා තියෙන කංසා ස්ට්‍රීට් කැනබිස් නෙමෙයි. ඒවා අගේ THC අගේ සහ CBD අගේ කොච්චරද කියලා ගන්න අය දන්නවා. එතකොට කංසා ගැන දන්න අය ගොඩාක් THC අධික කංසා පාවිච්චි කරනවා සමහර වෙලාවල් වලදී. THC අඩු ඒවා පාවිච්චි කරනවා සමහර වෙලාවල් වලදී. එතකොට ස්ට්‍රෙස් වගේ ඇන්සයිටි වගේ ડિප්‍රෙෂන් වගේ අසනීප තියෙනවා නම් එයාලා THC අධික කංසා වැඩිපුර පාවිච්චි කරන්නේ නැහැ. එයාලා පාවිච්චි කරන්නේ CBD අධිකව තියෙන කංසා. එතකොට මගේ පර්යේෂණ වලින් මේ පහුගිය අවුරුදු 5-6 අලුත්ම පර්යේෂණ වලින් පේනවා psychotic disorders, stress, anxiety, depression වල කියපු නම් සියලු දේවල් හොඳ කරන්න කංසාවල තියෙන CBD වලට පුළුවන් කියලා. ඒ නිසා තමයි CBD කියන ඖෂධීය මෙඩිකල් කැනබිස් කියන කොම්පෝනන්ට් එක වෙනම මාකට් එකක් හරි ගස්සලා දාලා තියෙන්නේ. එතකොට දැන් ලංකාවේ එතකොට එපිලෙප්සි වලට ඊට පස්සේ ඔටිසම් ස්පෙක්ට්‍රම් ඩිසෝඩර්ස් වලට PTSD වලට හරි කාන්සර් වල THC ඉතාම හොඳයි වේදනානාශකයක් හැටියට CBD හොඳයි සිරුර තුළ අවශ්‍ය කරන චිකිත්සීය ගුණ ලබා දෙන්න. හරි. එතකොට මම ඔයාලට ආයෙ කියලා දෙන්නම් මොකද්ද මේ එන්ඩෝ කැනබිනොයිඩ් පද්ධතිය කියන්නේ කියලා. හරි. මේක තමයි මෙන්න මේ එන්ඩෝ කැනබිනොයිඩ් පද්ධතිය ගැන චුට්ටකින් වතුරට දෙන්න. sorry. එන්ඩෝ කැනබිනොයිඩ් පද්ධතිය කියන්නේ දැන් අපේ ශරීරයේ තියෙනවානේ සර්කියුලේටරි සිස්ටම් එක, නර්වස් සිස්ටම් එක, රිප්‍රොඩක්ටිව් සිස්ටම් එක මෙන්න මේ වගේ අතපත ගන්න පුළුවන් සිස්ටම් වලට අමතරව තියෙනවා බයෝකෙමිකල් රියැක්ෂන් වලින් සිද්ධ වෙන යාන්ත්‍රණයක්. ඒක පටන් ගන්න ඉස්සර වෙලාම හයිඩ්‍රා කියන සතාගේ අවුරුදු මිලියන 600කට කලින් ඒ සතාගේ ඉඳලා සියලුම සත්ව වංශවලට මේ ජීන් එක ඇවිල්ලා තියෙනවා. එතකොට අපේ යංගේ එන්ඩෝ කැනබිනොයිඩ් පද්ධතියක් තියෙනවා. හරි. එතකොට මේ එන්ඩෝ කැනබිනොයිඩ් පද්ධතිය කරන්නේ මිනිස්යාගේ සෑම සෛලයක්ම පරිවෘත්තීයේ සමායෝජනය කරනවා. මෙන්න මේ පරිවෘත්තීය සෑම සෛලයකම පරිවෘත්තීය සමායෝජනය කරලා මිනිස්යා හෝ සත්වයාගේ කද්දේට ගන්නේ එන්නේ සමස්ථිතිය කියන එක ළඟා කරලා දෙන්න පුළුවන්. හරි. හැබැයි ඒක කරලා දෙන්න පුළුවන්නේ දැන් අර හෙල්දි අයයි අන්හෙල්දි අයයි කියලා මානසිකව අපි කැටගරිස් දෙකකට තියෙනවා. හරි. එතකොට අන්හෙල්දි කියන්නේ මානසිකව අස්වීපයක් තියෙන එක්කෙනෙකුට THC අධික කංසා භාවිතය හොඳ නැහැ. හරි. ඒක තමයි ලොකු ප්‍රශ්නේ වෙලා තියෙන්නේ. එතකොට ඔය මානසික අසනීප තියලා ආයතම CBD අධික කංසා වල දුන්නා නම් එයාලගේ මානසික තත්ත්වය ඊට වඩා හොඳ අතටපත් වෙනවා. මගෙනුත් කොල්ලෝ මේ වගේ අහනවා. හරි. එයාලා මට කියනවා මානසික අසනීප තියෙන කතා කරලා එයාලා කාංශ බොන අය. හරි. සමහරු කියනවා එයාලට kg බීපුවාම අර ආතතිය වැඩි වෙනවලු. හැබැයි ලෝකල් කාංශ බීපුවාම ආතතිය අඩු වෙනවලු. හරි. ඒකට හේතුව තමයි ලෝකල් කාංශ වල තියෙනවා CBD වැඩිපුර. ඉන්දියාවෙන් එන kg වල තියෙනවා THC වැඩිපුර. හරි. එතකොට මානසික ආතතිය ස්ට්‍රෙස් පිල් ඔය මොනවද ඔයාලා කියන්නේ හරි. යන්නේ මේ මානසික ආතතිය තියන අයට CBD කියන එක ඉතා හොඳයි. ඒ නිසා තමයි මුළු ලෝකෙ පුරාම දියුණු රටවල් වල මේ CBD කියන එක දැන් එළියට දාලා තියෙන්නේ. හරි. එතකොට ඒක දැන් මිනිස්සු නිතරම පාවිච්චි කරන දෙයක් බවට පත් වෙලා තියෙනවා. ඇත්තටම මේකෙන් මම කංශ පාවිච්චි කරන හින්දා මම ඒක හොඳට දන්නවා. හොඳට දන්නවා කියන්නේ මම දන්නවා. හරි. දැන් හිතන්න මෙහෙම හරි මම හවස් වෙනකන් කැම්පස් එකේ උගන්වනවා. හෙනට ආයේ මහන්සි මම ගෙදර ඇවිල්ලා ජොයින්ට් එකක් බිව්වොත් එහෙම හරි මට ආයේ මොළේ ඉඳලා වැඩ කරන්න පුළුවන් එනර්ජි එකක් ෆිට් එකක් මානසිකව රිලැක්සේෂන් එකක් හරි අන්න ඒ ගතිය මට හම්බුනා හරි ඒතකොට මම ගොඩාක් ආශ්‍රය කරනවා කාංශ බොන මිනිස්සුන් මම ස්පෝර්ට්ස් කරනවා ආශ්‍රය කරනවා මම කැම්පස් එකේ ක්‍රිකට් ගහුවා මම කැම්පස් එකේ වේට් ලිෆ්ටිං කරා වේට් ලිෆ්ටිං කරන රෙකෝඩ් එකක් තිබ්බා හරි මම ඩයිවිං පැඩි ලයිසන්ස් අරන් තියෙනවා ඒ පැඩි ලයිසන්ස් එක ගන්නකොට මම කාංශ ටිකක් බීලා හිටියේ අපේ කණ්ඩායම ජොයින්ට් එකක් බීලා තමයි මුහුදට බැස්සේ පළවෙනි වතාවට හරි එහෙම බයක් නැහැ ඇත්තටම ඒ බය චකිතය නැති කරගන්න මේ ඒ නිසා තමයි යුද්ධයට යන ඉස්තර සොල්දාදු මේක වැඩිපුර පාවිච්චි කරේ. ඒ කියන්නේ සටන් කිරීමේ හැකියාව වැඩි වෙන්නේ. හැබැයි අර මැරෙන්න බය නැති ගතිය. අන්න ඒක ඒ නිසා තමයි කාංශාවලට සංස්කෘත භාෂාවෙන් විජයා කියන නමක් දාලා තියෙන්නේ. කාංශාවලට සංස්කෘත භාෂාවෙන් අජයා කියන නමක් දාලා තියෙන්නේ අන්න ඒ නිසා. හරි. එතකොට මම පහුගිය අවුරුද්දේ ටූරිසම් ක්ෂේත්‍රයේ රැකියාව කරනවා විවිධ තැන්වල. මම ආරුගම්බේ ගිහිල්ලා හිටියා මාස 3ක්. ආරුගම්බේට වැඩිපුරම එන්නේ සර්ෆ් කරන පොල්ලක එල්ලෝ. මට හම්බුලා දෙනවා රටවල් 30ක විතර ටුවරිස්ට්ලා. ඒ හැම රටකම වගේ හරි. එයාලා කියනවා ලංකාවේ තරම් දරුණු කාංශ නීතියක් නැහැ. හැම රටකටම CBD නිෂ්පාදන තියෙනවා. ටූත් පේස්ට් තියෙනවා. ක්‍රීම් වර්ග තියෙනවා. හරි. හෑන්ඩ් බෑග්ස් තියෙනවා. හරි. එතකොට THC අඩංගු රික්‍රියේෂනල් කාංශා නීතිගත කරලා නම් shops තියෙනවා. නීතිගත කරලා නැත්නම් ස්ට්‍රීට් එකේ තියෙනවා. හරි. ඒවත් පොඩ්ඩක් ළඟ තිබ්බට පොලිසියෙන් අල්ලන්නේ නැහැ. හරි. ගොඩක් ළඟ තිබ්බොත් තමයි පොලිසියෙන් අල්ලන්නේ. හරි. මේ වගේ මේ දියුණු රටවල් කියන රටවල් වල මේවා නීතිගත කරමින් හරි නීතිගත කරන්න උත්සාහ කරමින් දැන් සකස් වෙමින් යන. එතකොට මේ හැමෝම මට හම්බුලා තියෙන ගොඩක් තරුණ තරුණියෝ සර්ෆ් කරන අය. සර්ෆ් කරන්න කලිනුත් ජොයින්ට් එකක් ගන්නවා. ඒ කියන්නේ අර ජොයින්ට් එකක් ගහලා සර්ෆ් කරන්න පුළුවන්. එතකොට මේ එන පිටරට අයගේ choice of එයාලා මූලික වශයෙන් හවසට රෙස්ටෝරන්ට් එකට ආවොත් එයාලා කැමති ජොයින්ට් එකක් බොන්න. හරි. එයාලා අරක්කු බොන්නේ නැහැ. හරි. එයාලා කැමති ජොයින්ට් එකක් බොන්න, සමහරවිට බියර් එකක් බොන්න, සමහර වෙලාවට ඒ හවසටම බොන්නේ ජොයින්ට් එකකුයි බියර් එකකුයි විතර. කෑමට කලින්. ඊට පස්සේ අරක්කු බොන්නේ නැහැ. ඒ මිනිස්සු සමහරවිට සිගරට් බොන්නේ නැහැ. එතකොට මැනික් පතල් වලට බහින අය හරි මාස එකමාර දෙකමාර මුහුදේ මාළු වලන මිනිස්සු හරි ඊට පස්සේ ලොකු ඉහළ කනතුරු වල ඉන්න අය හරි හමුදාවේ නිලධාරීවරු කට්ටිය හරි හමුදාවේ කොල්ලෝ කෙල්ලෝ හරි පයිලට්ලා හරි මට පයිලට්ලාත් කතා කරන්න තියෙනවා හරි මගේ පයිලට්ලාත් කාසක් දීලා තියෙනවා මම දකිනවා 70%ක් නියෝජනය කරන පිරිස ලංකාවේ ඉතාම ධනවත් හරි වෙලෙන්දු හරි යන කාංශ පාවිච්චි. එතකොට දැන් මෙතන තියෙන්නේ කාංශවල වැරද්දක් නෙමෙයි. හරි. අපි කාංශ හරියට තෝරාගෙන නැහැ. කාංශ ලබා දිය යුත්තේ කාටද කොහොමද කියලා. මෙන්න මේ දේ පිළිබඳව ඔයාලා නැවත අවධානය යොමු කරොත් ලංකාවේ තියෙන මානසික ප්‍රශ්න වලින් බොහෝ දෙයක් කාන්සාවල තියෙන CBD වලින් හොඳ කරන්න ඔයාලට පුළුවන් වෙනවා. මේ තමයි මගේ අලුත් පොත. මේ පොතේ තියෙනවා පරිපත්‍රිකා 560ක විතර හරි උපුටා ගන්නා ලද තොරතුරු සහ රූප සටහන් වර්ණවත්ව පෙන්වමින් මොකද මේ දැන් ඉස්සර කැනඩාව වගේ රටවලත් කැනබිස් ගැන හිතුවේ ගේට්වේ ඩ්‍රග් එක කියලා. හැබැයි සපාරේෂකයෝ කිසිම කෙනෙක් පරීක්ෂණ කිරීම අතහැරියේ නැහැ. අනිත් එක කාන්සා කියන්නේ තහනම් කරපු ශාකයක් මිස කාන්සා ශාකයේ බිහි වෙනකොටම තහනම් වෙලා ආපු එකක් නෙවෙයි. ඒකට කාන්සා ශාකයේ මේ ලෝකේ තහනම් කරන්නේ බටහිර අධිරාජ්‍යවාදීන්ගේ දුම්කොළ සිගරට් සහ ඔපියම් බිස්නස් එක වැඩි කරගන්න කියලා. ඒ පිළිබඳව තොරතුරු මගේ ළඟ හොඳටම තියෙනවා. ඒවා මගේ අලුත් පොතේ තියෙනවා. එතකොට ලංකාවේ ඉස්සර කාලේදී කාන්සා වලින් හදපු කැඳ බොන තැන් තිබ්බා. කාන්සා වලින් නිෂ්පාදනය කරන හැෂ් කියන වර්ගය විකුණන තැන් තිබ්බා. කාන්සා වල වියලි කාන්සා විකුණන තැන් තිබ්බා. ඒවට ඉංග්‍රීසියෙන් නම දාලා තිබ්බේ බාම් ෂොප්. BHANG බාම් ෂොප්. බාම් කියන්නේ කාන්සා වලට කියන තව නමක්. එතකොට මෙන්න මේ බාම් ෂොප් වල කාන්සා වියලි කාන්සා කැඳ හැෂ් විකුණන්න තිබ්බ බව පරණ ඇක්සොල මම S2 කියවලා තියෙනවා. ඒවා මගේ විනලු පොතේ බලන්න තියෙනවා. එතකොට 1929ට කලින් ලංකාවේ ගම්මානවල නගරවල කාටවත් බදු ගෙවන්න නැතුව කවුරුත් එපා කියන්නේ නැතුව බුලත් පිට කඩ තියෙන ලංකාවේ පාරවලට තැඹිලි කඩ තියෙන අන්න ඒ විදිහට කාන්සා විකුණන තැන් තිබ්බා. ඒ වගේ සුද්ධෝ ටැක්ස් එකතු කරන්න පටන් ගත්තා. ටැක්ස් එකතු කරන්න පටන් අරගෙන ක්‍රමක්‍රමයෙන් කාන්සා වහලා සිගරටුයි දුම්කොළ වගාවයි රාතහනම් කරා කොපි වගාවයි ආරම්භ කරා. ඒවා පිළිබඳව විස්තර මම හොඳට කියවලා තියෙනවා. එතකොට මේ ඔක්කොම දිහා බලනකොට අපිට පේන දෙයක් තමයි අපි මේ අපේ අර ඇක්ට් එකේ කියලා තියෙනවානේ අපේ ආයතන වලින් කියලා තියෙනවානේ ඇඩික්ට් එකේ කියලා තියෙනවානේ අමද්‍ය ව්‍යාපාරය කියලා තියෙනවානේ මේ කාන්සා කියන්නේ මහා භයානක අන්තරාදායක ද්‍රව්‍යයක් කියනවා. එතකොට මෙන්න මේ ආයතන නියෝජනය කරන අය සහ රජය නියෝජනය කරන අයට කාන්සා හොඳයි කියලා කියන්න බෑ. කාන්සා හොඳයි කියලා කියන්න බැරි වෙන හේතුව තමයි ඒ රජය තුල අන්තරාදායක මත්ද්‍රව්‍යයක්. ඒක ඇක්ට් එකකින් අපිට දුන්න දෙයක්. ඒක දුන්නේ 1929 දී. එතකොට 1920 ගණන් වලදී මුළු ලෝකෙම පුරාම මෙන්න මේ සංසිද්ධිය සිදු වෙමින් ගියා. හරි. ඊට පස්සේ 61 දී තමයි ඒවා ස්කෙඩියුල් 4කට දැම්මේ. හරි. ඊට පස්සේ 2020 දී ඒ ස්කෙඩියුල් රීස්කෙඩියුල් කරලා ඩේන්ජරස් ඩ්‍රග් කියන තැනින් කැනබිස් අයින් කරලා පළවෙනි කැටගරි එකට දැම්මා. පළවෙනි කැටගරිය කියන්නේ ඇඩික්ට් වෙන්න පුළුවන් කියන එක. ඇඩික්ට් වෙන්න පුළුවන් කියන එක. හැබැයි එතකොට ඇඩික්ට් වෙන්නේ ඩේන්ජරස් ඩ්‍රග් එකකට නෙමෙයි මෙඩිකලි ඉම්පෝර්ටන්ට් ප්ලාන්ට් එකකට. දැන් මෙන්න මේ විදිහට තමයි මේ සයන්ටිෆික් ඉවොලූෂන් කියන එක සිද්ධ වුණේ. එතකොට ඇත්තටම ලංකාවේ සයන්ටිස්ට්ලා නැහැ රිසර්ච් කරපුවාක් නැහැ කැනබිස් ගැන. වැඩිපුරම ඔයාලට ડોක්ටර්ස්ලාට ඉන්නේ අර මම කියපු 30 වල්නරබල් ගෲප් එක අරගෙන ඒ තුලින් වෙච්ච රිසර්ච් තමයි ඔයාලා ගාව තියෙන්නේ. එතකොට දැන් ඔයාලා උත්සාහ කරන්න ඕනේ හෙල්දි මිනිස්සුන්ගේ ස්මෝකර්ස්ලා ගෝයින් ස්මෝකර්ස්ලා 500ක් විතර අරගෙන එයාලට මේක ගැන දැනෙන එක කර සහ ඔයාලගේ ස්ටැටිස්ටික්ස් ඇත්තටම ඔයාලගාව තියෙන සංඛ්‍යාලය. ඒතර මම ඔය ගොඩක් වෙලාවට ඔයාලගේ වෙබ්සයිට් වලට ගිහින් ඔයාලගේ ඇනුවල් රිපෝට්ස් එකෙන් බලනවා. හරි. එතකොට සයිකොලොජි මානසික ස්පිරිතාලේ රිපෝට්ස් එක නම් බලලා තියෙනවා. ඒ වගේ වැඩිපුරම තියෙන්නේ රිසර්ච් නෙමෙයි. ඒ වගේ තියෙන සංඛ්‍යාලයක. එතකොට ඒ වගේ අපිට දකින්න තියෙනවා කැනබිස් නිසා අසනීප වෙච්ච සයිකෝසිස් තැරික කීදෙනෙක් ඉන්නවා. හැබැයි ඒ සයිකෝසිස් හැදිලා තියෙන්නේ අර වල්නරබල් ගෲප් එකේ ගොඩක් අය. මේ මොකද මම දන්න කාසබන කාටවත් ඔය වගේ මානසික අසනීප වම්බෙනවා දැක්කද? එතකොට ඔයාලා වැඩිපුරම කතා කරන මානසික අසනීප හැබැයි කාන්සා වලින් බෙහෙත් හොද කරගත්ත ලෙඩ හොද කරගත්ත අය මම ගොඩාක් දැකලා තියෙනවා. ඒක මට මෙඩිකල් ડોක්ටර්ස්ලා MBBS මෙඩිකල් ડોක්ටර්ස්ලාත් මට කතා කරනවා. කතා කරලා එයාලා මගෙන් ඉල්ල ගන්නවා කැනබිස් ඔයිල්. සමහර පේෂන්ට්ලට මගෙන් ඉල්ලගෙන කොහෙන්ද ගන්න කියලා අහලා මම ඉන්ෆෝමේෂන් හරහා පේෂන්ට්ට ලබා දෙනවා. එතකොට අපේ කාන්සා අඩංගු දේශීය බෙහෙත් පාවිච්චි කරලා හරි ෂුගර් අඩු කරගත්ත අය ડોක්ටර්ස්ලා හරි මට ඉන්න ගොඩක් ලංකාවේ ඉන්න ඇකඩමික් කෙනෙක් හරි මම PhD එකක් කරපු මිනිස්සෙක් හරි එතකොට මම කියන ඩිසිප්ලින් එක අනුව මට බොරු කියන්න බෑ හරි මම කරන්නේ පාර්ට්නර්ෂිප් වල අවුරුදු
You have 10 minutes more.
එස් මම අවුරුදු 98 ඉඳලා පාර්ට්නර්ෂිප් වල මම ඉන්නේ මම සෑහෙන කාලයක් පරීක්ෂණ හිටියා මම කියවනවා මම විවිධ ක්ෂේත්‍ර ගැන පරීක්ෂණ කරලා තියෙනවා හරි කැනබිස් මගේ එක ක්ෂේත්‍රයක් ඒක ඇත්තටම මේක මගේ ක්ෂේත්‍රීය රියුතු නෙවෙයි මේක වෙන්න තිබ්බේ ડોක්ටර්ස්ලා තමයි ඇත්තටම ලෝකෙ ඉස්සර වෙලාම කාන්සර් පරීක්ෂණ කරන්න පටන් ගත්තා හරි ඒක අපේ රටට නැති වුණා මේ තහනම් කරලා මේක මම ඔළුවලා මේක පාලනයට යන්න පස්සේ හරි මොකද තාම ඔයාලා කියන්නේ ඔයාලා ස්ටිග්මටයිස් කරපු ශාකයක් කියලා හරි මට මේ ළඟදී මගටයි මහේෂ් කතාවක් කියනවා අපි බොහොම අමාරුවෙන් හරි පහතට දාලා තියෙන ශාකය නැවත උඩට ගන්න දරනවා කියලා හරි ඉතින් ඒක එහෙම වෙන්න බෑ මොකද මේ දැන් හරි මුළු ලෝකේ අනිත් එක මේක මේ අපේ රටේ තිබ්බ දෙයක් හරි ඉන්දියාවේ ලංකාවට ඇවිල්ලා ලංකාවේ ඖෂධ හදලා හරි රාවණාගේ පොත්වල සිට හරි ඒවා ඔක්කොම අපිට මිනිස්සු කතා කරනවා අර දකින්නවා මේ පුරාණ පුස්තකවල තියෙන විස්තර මම අනිත් එක මේක ගොඩාක් කියවලා තියෙනවා මම පහුගිය අවුරුදු 12ම කතා කරේ රිසර්ච් කරේ කියෙව්වේ වැඩිපුරම කාන්සර් ගැන මොනවා ගොඩාක් රටවල ඇවිදලා තියෙනවා මේ හැම රටකදීම වගේ මම මිනිස්සුත් එක්ක කාන්සර් පාවිච්චි කරලා තියෙනවා මගේ ඇකඩමික්ස්ලා ඉන්නවා එතකොට මට හිතෙනවා අපි ඇත්තටම මේ ලංකාවේ කාන්සර් ස්ටිග්මටයිස් කරපුවාම කිසි කෙනෙක් රිසර්ච් කරන්නේ නැහැ ඒකෙන් අපි ඉන්ටර්නැෂනල් කැනබිස් සයන්ස් කියන තැනට එක්ස්පෝස් වුණේ නැහැ. මම දන්නේ හැටියට ලංකාවේ කිසිම ඇකඩමික් කෙනෙක් හරි එක්ක මෙඩිකල් රිසර්ච් එකේ කිසිම කෙනෙක් හරි කිසිම ඉන්ටර්නැෂනල් ආටිකල් එකක් ලියන්න නැතුව ඇති කැනබිස් නිසා මේවා වෙනවා ඒ නිසා වෙන රටවල් වල සංස්ථා නීතිගත කරගෙන නවත්තන්නේ. හරි දැන් වෙන රටවල් වල මේ ලෝකේ දියුණුම රටවල හරි කාන්සර් කියන එක දැන් එළියට අරගෙන කර්මාන්ත 3ක් සඳහා පාවිච්චි කරනවා. 3ක් සඳහා හරි එකක් සඳහා නෙමෙයි. දැනට ඔයාලට තියෙන ඔයාලා වැඩිපුරම හිතන්නේ හරි කැනබිස් ස්මෝකින් හොඳ නැහැ කියන එක. හරි දැන් රුවන් ડોක්ටර් රුවන් අවසානයේ කිව්වේ ඔයා ස්මෝකින් කියන එකට දෙන්න එපා කියලා. අතන කැනබිස් ස්මෝකින් කියන එක හොඳයි. tobacco smoking වලට වැඩි. එතකොට 2012 දී පමණ මේ වෙනකොට ඇත්තම ස්මෝකින් කියන කල්චර් එක ඒක කල්චර් එකක්. ඒක හිස්ටරි එකක් තියෙන බොහොම පරණ දෙයක්. හරි. එතකොට මේ මිනිස්සු විවිධ ශාක ද්‍රව්‍ය හරි මිනරල්ස් වර්ග බර්න් කරලා ස්මෝක් කරනවා. හරි. යාලා ඉන්හේල් කරලා එයාලගේ මනස උත්තේජනය කරනවා. මේ වගේ රසායන දෙන්නේ මේ ගස්වල. හරි. සමහර රසායන වලට ඔයාලගේ උත්තේජනය කරන්න පුළුවන්. හරි. ඉතින් ඒ රසායන තමයි අපි පෙති හැටියටත් අරගෙන අපි උත්තේජනය කරගන්නේ. හරි. දැන් අපි ලෙඩක් හැදුනහම අපේ සිස්ටම් එකක් අපේ බයෝකෙමිස්ට්‍රි මොලිකියුලර් බලවත් හරි. මේවා අපිට උත්තේජනය කරගන්න තමයි අපි පෙත්තකින් රසායන ගන්න. හරි. එතකොට ඒවා ස්වභාව ධර්ම අපිට තිබ්බා. ඒ වගේ තමයි මිනිස්සු ඒ අවශ්‍ය දේවල් දුමත් ඒ වගේ මිනිස්සු ප්‍රැක්ටිස් කරලා ළඟා කරගත්ත දෙයක්. දැන් ලංකාවේ හඳුන් කුරු වත්තර පට්ට කරනවා බලන්න. හරි. උදේට කඩමන් එකකින් යන්න බලන්න. හරි. පන්සල් වලට යන්න බලන්න. හරි. කොයිතරම් හඳුන් කුරු මේ ඔක්කොම දුමනේ තියෙන්නේ. ඒ කියන්නේ මේ දුමත් සමග බැඳිච්ච ලොකු ඉතිහාසයක් මේ මුළු ලෝකෙ මිනිස්සුන්ට තියෙනවා. හරි. ඒක දකුණු ඇමරිකාවේ ස්මෝක් කරා යාලා දුම්කොළ කියන්නේ. හරි. ඒකට ආසියානු මිනිස්සු ස්මෝක් කරේ නැහැ. ඒක බර්න් කරලා ඉන්දියන් කරා. හරි. කැනබිස් හැටි. කැනබිස්. ඊපස්සේ ඇෆ්ගනිස්තානයේ පැත්තේ වර්ධින මේ මෙඩිටරේනියන් පැත්තේ හරි. එයාලා ඔපියම් කියන එක භාවිත කරනවා. හරි. ඒක එක් පැත්තකින් මෙඩිකේෂන් එකක්. හරි. ඔපියම් ඇඩික්ටිව් 100%. හරි. ඒ නිසා තමයි ඔපියේට්ස් අඩංගු බෙහෙත් හරි ගැන කොහොම කල්පනා වෙන්නේ මිනිස්සුන්ට දෙන්නේ. එතකොට කැනබිස් වල
You have 5 minutes more.
Okay. එතකොට කැනබිස් ඇඩික්ෂන් කියලා එකක් මම කනස බොන කෙනෙක් හැටියට මට දැන් අපි දන්නවා ඇඩික්ෂන් වුණාට පස්සේ හැදෙන සික් එක මොනවද? එහෙනම් අන්න ඒ වගේ සික් එකක් හැදිච්ච කවුරුවත් අපි දැකලා නැහැ. ඉතින් අපි කනස බොන්න නැතුව ඉන්න ඕන තරම් දවස් තිබ්බත් අපි බොනවා අපි ආසයි. හැබැයි අපි කැමති මම දැන් ડોක්ටර්ස්ලා හින්දා කියලා සාමාන්‍ය මිනිස්සු හවසට අඩියක් ගන්න කරනවා. මම හේන් ඥානවත් ආයෙ හිටියනේ. මම මොනවාකට ස්ටික් අවුරුදු 3ක් හිටියා. තනමල්ල හේන් වල හිටියා. මම දැකලා තියෙනවා දිග ලෝකල් ජොගින් ගහන අවුරුදු 60 65 බෲස් විලා ජොගින් අඟවල් තියෙන මිනිස්සු. ඇත්තට මේ මිනිස්සු අඟවල් නිකන් බෲස් විලා ජොගින් තමයි. අපේ ඔය ඉන්න සිරිපාල මාමලා දයා මාමලා අඟවල් ගත්තාම නිකන් බඩේ තියාගෙන ආයේ වෙන්නේ. හරි. තාම මාර්ග පිටේ වැඩ කරන්නේ. එයාලා අරක්කුත් බොනවා හම්බුනොත්. හැබැයි එයාලා වැඩිපුර කැමති කාන්ස පිළක් බොන. කාන්ස පිළා මිනිස්සු බුදිය ගන්නවා. මේ ඉරෙස්පොන්සිබල් මිනිස්සු කාන්ස පිළ නිදා ගන්නවා නේ. හැබැයි රෙස්පොන්සිබල් මිනිස්සු මම ආශ්‍රය කරලා තියෙන වැඩිපුරම රෙස්පොන්සිබල් මිනිස්සු. ඒ ශක්තිමත් මිනිස්සු, හෙල්දි මිනිස්සු, ගෝවියෝ, වෙලෙන්දෝ, මාළුකාරයෝ, මැණික් කටල් හරන්නේ. ඉතින් ඒ වගේ ආමිකාරයෝ, STF එකේ පයිලට්ලා, ලියන්නෝ, සින්දු ලියන්නෝ මේ ඔක්කොම ආශ්‍රය කරලා. හැබැයි ඒ කාටවත් ජොයින්ට් එකක් දෙන්නට පස්සේ නින්ද යන්නේ නැහැ. අපි ජොයින්ට් එක ගහන්නේ අපේ මනස උත්තේජනය කරලා අලුත් නිර්මාණ කරන්න අවශ්‍ය නිසා. එතකොට කුඹුර උදැල්ල වුණත් ජොයින්ට් එකක් ගහලා උදැල්ලක් ගත්තාම අර හේන්ඥායක පට්ට අවුවේ හරිද? පැය දෙක තුන වැඩ කරන්න පුළුවන්. හරි. අන්න එහෙම මාර ශක්තියකින් වැඩ කරන මිනිස් කොටක් ඇත්තටම ඉන්නවා තමයි. එතකොට ඔය වෙල්ලස්ස කරල්ල කාලේ වෙනකොට තහනම් කරලා තිබ්බේ නැති නිසා කාන්සා හැම තැනම තිබ්බා. ඒ අර පරණ පනත් බලනකොට පේනවා ඒ වගේ තියෙනවා ග්‍රාමීය කාන්සා කඩවලින් එක්කම කරගත්ත බදු මුදල් නාගරික ප්‍රදේශ වලින් එක්කම බදු මුදල් කියලා වෙනම එකක් තියෙනවා. හරි. වැඩිපුරම තියෙන ග්‍රාමීය ප්‍රදේශවල. ඒව නිකන් ගොඩක් කල් මිනිස්සුන්ට ආශ්වාදයෙන් මිනිස්සුන්ට එනර්ජි එකට තිබ්බ තැන. රාජ්‍යයක් වොන්න තිබ්බ ඒ දවස්වල. ඒතර මේවා ඔක්කොම නැති වෙලා තමයි අධිරාජ්‍යවාදීන් අපිට එයාලගේ දේවල් ගන්න දුන්නේ. ඊට පස්සේ එයාලා අපිට මෙඩිකල් සයන්ස් කියන්නේ ඉගෙනුවා. එයාලගේ මෙඩිකල් සයන්ස් තුළ තියෙන එයාලගේ මෙඩිකල් ප්‍රොඩක්ට්ස්. එතන තියෙන ඉක්විප්මන්ට් තියෙනවා, කෙමිකල්ස් තියෙනවා, කිට්ස් තියෙනවා, බෙහෙත් තියෙනවා, ටැබ්ලට්ස් තියෙනවා. එතකොට අපි MBBS ඩිග්‍රී එකට පස්සේ එයා ඇත්තටම ප්‍රොමෝට් කරන්නේ එයාගේ කල්චර් එක. එතකොට MBBS ගත්ත කිසි කෙනෙක් හැමෝම ඉගෙන ගන්නේ කැනබිස් කෝස් සයිකෝසිස් කියලා. ඒ පාඩම පොත් වෙන්නේ සමහරවිට. දැන් ඔයාලා සමහරවිට මෙඩිකල් ඇත්තටම අපි සිලබස් අලුත් වෙනවා නම් හරි. අපේ මෙඩිකල් ඩොක්ටර්ස්ලා පිටරටත් එක්කලා සම්බන්ධකම් තියෙනවා. හරි. එහෙනම් අපි මේ වෙනකොට කැනබිස් ගැන මීට වැඩිය පොසිටිව් ඩයලොග් එකකට ඉන්නේ.
Okay.
Yeah.
Thank you, Dr. Weliange. So I basically I'll try to do the brief translation for our friends, our students at York University and University at Buffalo. So Dr. Wasantha Weliange, he does a lot of advocacy for cannabis. According to him, it's a safe recreational drug, and he highlights that there are many research in the recent years, tons of research being done, and these research highlight about the therapeutic effects of cannabis. And he indicates that especially the doctors, psychologists and psychiatrists are dealing with vulnerable population. So we always see the pathological side. So he highlights about the non-pathological side of cannabis, and he says that cannabis, cannabinoid oil, and other derivatives are important in to managing various types of ailments, especially pain management, anxiety, and he says hundreds of ailments can be dealt with cannabis related ingredients. And also he says the prohibition of cannabis, the criminalization came with the tobacco industry, has a lot to do about it. And he very elegantly mentioned about the history. So I think he has a point. He has a point, but also as psychologists and as psychiatrists, we always try to highlight and we try to point out some of the negative side of cannabis use. And I was waiting for Dr. Manoj Fernando. He was so keen to take part in this discussion, but unfortunately he had a family commitment and he had to go to Jaffna. So he has sent me a few points. He wanted me to mention it here. And he says that there are a number of health harms in cannabis, and there's a specific addiction to cannabis, which we call cannabis use disorder. And risk is high if initiated at early stage and used frequently. And according to Dr. Manoj Fernando, it's a
Oh, doctor.
Dr. Manoj Fernando.
14යි මාත් එක්කම.
මට ස්ටාප් ඩියුටි කැලලක් එක්කව කරන්න ඕනේ.
Okay. May I finish with Dr. Manoj Fernando's narrative?
Yes,
Yeah. So what Dr. Manoj Fernando's point is, so after alcohol, marijuana is the substance most often associated with impaired driving, and cannabis use negatively and likely permanently affect the brain development in the early years of life. There are lots of research to prove, and impacting on attention, memory problem solving skills and behavior, resulting in poor academic performance and drop off IQ by 2 points or more. So also he says smoking cannabis can cause increase the risk of cancer, and it has increased risk of stroke, heart disease, and other vascular diseases, especially if smoked. Increased risk of bronchitis, cough, mucus production in lungs with possible association with COPD. So increased risk of cannabis-induced psychosis, schizophrenia type of symptoms, depression, social anxiety, thoughts of suicide attempts, and suicide. Cannabis use worsen existing mental illness. So use in pregnancy also causes negative effects like low birth weight, abnormal neurological development, impaired brain development, impacting attention, memory, problem solving skills and behavior. So also he states that he writes about the culture around cannabis and recent research. So what basically Dr. Manoj Fernando says is cannabis is bad for mental health. It's true because it's really good that we have different opinions, different stands. So I highlighted my point. I pointed out the psychological aspects of using cannabis, what are the problems that can cause, and also causing a legal problem is also, it becomes a psychological rate later on, because I have one case study. This young student, he was doing his A levels, and soon after while doing A levels, he was smoking cannabis, and he had some problems, mental health problems as legal problems. So the family had to face consequences. So these all, I mean, it's a sort of a package because of the health related issues as well as socio-cultural issues and legal issues. So I told my stand, I don't believe in criminalization, any drug. Because these days I'm writing a paper, decriminalization, whatever the so-called harmful drugs, because the best thing is health education, because we are today in everywhere, in Canada, in America, US, Australia, even in Sri Lanka, we are spending a lot of money on this war on drugs, and still we are fighting. For how many decades we are fighting? So it's a never-ending war. So I believe in health education. So I think we have to see the both parties. Actually, I'm glad that Dr. Weliange brought a lot of insights. Some of the points we agree, and we, as health practitioners, some of the points we disagree. So it doesn't matter. Like we are not fighting with each other. We are exchanging ideas. We are expanding our insights. So Dr. Upali Peris, our psychiatrist, and Dr. Manoj Fernando and myself highlighted about the cannabis and mental health, and Wasantha Weliange gave very strong points, and he actually highlighted the sociological side of cannabis in Sri Lanka, which we were not very much aware of. Actually, going back to the pre-colonial period and what happened during the colonial period and during the wars. Yeah, that was very interesting. And we would like to open our forum for questions. If you want to ask any question, we can answer. Yeah, Vasantha, please go ahead.
My first question, according to Sri Lankan doctors, this is a very bad substance and can cause many problems to us, right? And yes, and hundreds of diseases can be caused by cannabis, right? According to Sri Lankan educated doctors, right? But now I'm asking, why in this developed world, right, with very good laboratories, with very good universities, with very good political systems, right, and with very good healthcare systems, right, why they have legalized this bad substance?
Yeah, my point is this. Actually, there is a therapeutic side of cannabis, which I mentioned. And being said that, I told that these it
No,
has
now,
therapeutic
Ruwan.
effects, but it shouldn't be a recreational drug. That's my stand. And also, I mentioned about the legalization. Why Canada legalized the recreational use of cannabis in 2018. There are many reasons. There are many experts. They have a group of people who were against that, and also they were very good experts, very educated experts. They wanted to legalize, and also there were other issues from the bikers, from the Montreal or Hells Angels effect. So Canada took the initiative. Even before, way before some of the states in the US, because in some states in the US, it's still prohibited. It's still an illegal drug. So what I think is it's the future. Yes, now a lot of medication, there are a lot of chemicals and a lot of medication being prescribed, cannabis-based medication. So I think within another 10 to 15 years, we'll have a different opinion. Being said that, still we have to see the pros and cons of cannabis and how it affects the mental health. Any other question? What about the participants? You want to ask any question? Or if you want, you can email us, email me or Wasantha. So we'll try to answer. Wasantha, do you want to mention something?
Yeah, yes, and yes, now in the early days, the cannabis was wild grown. Now there are hybrids. The hybrids are made with a lot of THC, right? So in Sri Lankan local cannabis, there are still all are local varieties with less THC, right? And now in the market, so we bring from other countries, smuggled Sri Lanka, from Morocco, from India, from Afghanistan, different type of cannabis products like hash, kush, right? And these kinds of things are coming. I know because I was in the deep market inside that, right? So there's a lot of money going from Sri Lanka to other countries for hash and kush, and also for Indian KG, right? So there are people, they prefer only Indian KG brand, right? And they don't, I mean, they will drink a beer or arak or something else if they're tired, right? But their day to day, right? Energy boost, right? And emotional health is given by cannabis, right? And yes, that is what I knew from the society, right? And we are sending a lot of money, and we have the best cannabis varieties. And in Sri Lankan situation, cannabis genes are not protected anywhere. Even in the highest agricultural research station, there is no cannabis seeds protected, right? And cannabis seeds are protected in Sri Lanka only by illegal farmers, right? Every year after harvesting, they will preserve some seeds for the next cultivation year, right? That is how year by year, since 1929, they preserve these genes as live seeds, right? Now, now these days, police trying to arrest every cannabis plantation, right? With the use of helicopters, with the use of drones, with the STF, with the commandos, and whatever the best technology they are using for this, and they will cut those strings plants before they are mature. and the seeds are, we are losing the genes of cannabis seeds, right? And farmers, illegal farmers, having difficulty finding seeds for the next generation. And according to some olive inscriptions, there were like 200 different cannabis varieties was in Sri Lanka for different purposes, for industrial, to get hemp, and for recreational purposes, right?
But
Now people,
yeah, Vasantha, but Ayurvedic department, they are allowed to grow cannabis for their Ayurvedic.
No. Now, other thing, nobody is allowed to cultivate cannabis in Sri Lanka. But Ayurveda department produce cannabis-based medicine. From where do they get the cannabis? Those are taken by the police, the custody, right? When they are unmature, where the young stage, right? There are no flowers, no trichomes, no THC, no CBD. There are only stems and leaves, right? Those young cannabis plants are taken and they are piled into tractors, unhealthy way, right? And taken to the courts. From courts, it transferred to the Ayurveda department. They store them in very secret places with a lot of rats, right? And after like many months, those dried and corrupted cannabis, useless cannabis, are sold to the manufacturers. So the manufacturers, they come and collect their ration of cannabis for cannabis-based drugs. And by using those cannabis-based drugs, people don't get healed because that cannabis is not up to the standard. So then people again say the Sri Lankan medicine is very bad. Right? So there's a mafia behind this, that they want to destroy Sri Lankan Ayurveda as well as cannabis-based medicine. In the Sri Lankan pharmacopoeia, there are 30 different cannabis-based medicine. So now we know in the developed countries, there's a medical cannabis industry. They say medical marijuana, medical cannabis, right? We also had medical cannabis industry in the past, right? We are a very rich country with a medical cannabis industry, right? In the pharmacopoeia, there are 30. It was written by the British people in 1937 or something, right? And before, in all our manuscripts, right, there are like hundreds of different preparations made of cannabis, because cannabis can cure any disease. And that is why it is called Sarva Rogagni in Sanskrit. There's a name for cannabis, Sarva Rogagni, right? And you know, the best scientists in the world who did cannabis research are from Israel, right? Raphael Machola and his people, right? He lived like 90 plus years, right? He is called as the father of cannabinoids, right? I'm sure this none of Sri Lankan doctors know anything about what is happening in this world about regarding cannabis, right? So they have to start this question asking themselves, why the hell in other countries legalizing this such dangerous drug? They have to ask it from themselves and find the answer, right? So this change of mind, change of attitude will come from that question, right? And we know, and Sri Lankan students in other countries, Sri Lankan doctors in other countries, right? They know that, right? So they have to start talking. If you don't talk that, Sri Lankan sick people, Sri Lankan mentally handicapped people are still going to take pharmaceutical drugs, right, which are not going to help them to cure the disease, but to bring it down. Right? All these psychological drugs, tablets, right, they are mostly sedative, right, and they cannot cure the people, right? And many drugs, some people tell me, right, they are not for the human beings, they are for the veterinary purposes, right? And you know, what a bad thing we are doing, right? And autism, epilepsy can be healed with CBD, right? We have been doing it for a long time, right? And since 1929, after this British people, right, angrily they cannabis illegalized in Sri Lanka. With anger. They didn't do it for help us, right? So they were our rivals in 1929, right? And in 1815, we fought with them, right? And they captured Kandy, right? And there were guerrillas, Sri Lankan guerrillas fighting with them, right? And we were fighting Hamdu to right? We had a great history, right? You know, from Anuradhapura, Polonnaruwa, Sigiriya, whatever the ancient things, right? And we had cannabis during that time freely available for medication and for all these. I told you about bang shops, right?
Do you
We
find
had
any
cannabis.
writings about cannabis in Mahavansa?
Mahavansa, no, I haven't seen anything. No.
Okay.
But in
Okay.
but in Buddhadasa Saraka Sangrahaya, that I have seen.
So
Right.
King Buddhadasa mentions about cannabis and using it as a medication.
Yes,
Yeah,
that
actually, yeah, in my presentation, I mentioned about the recent research in Canada, in the US, and some of the Israeli research, and how they are using cannabis to treat people with various ailments like fibromyalgia, epilepsy, and various types of anxiety conditions. So thank you very much. We have so we have to wind up because of the time
Can I-
factor.
Can I- just 1 minute.
Yeah, most welcome.
Yes,
Dr. Peris. Yeah.
keep my mouth shut because you know the one that he is pointing out. What some of the you know the points that he made out is worth considering. But the question that he finally said that this why in developed countries that by it has been decriminalized, why not Sri Lankan doctors are not taking it as taking it positively. But Vasantha, do you know even you are talking about very high of Israel. Even in Israel, it is illegal, right? The cannabis is still legal, but it's
yes.
often unenforced. You know that is how it is said. But and even in the United States, not all the states that it is decriminalized. In some states, it's illegal. Like say China, Russia, Australia, and Singapore. There are so many other countries which are developed.
Yeah,
There are high
yes.
like you. Yeah, it's still
Actually,
illegal.
I was reading now these days. I see more countries in the world doing research about cannabis. More countries, right? In the beginning, it was separate countries. Germany itself did research. Israel itself did research. Then it became international research, right? And now Thailand is doing research with America and some other countries, right? And so, doctors, I'm not actually blaming you, right? I see what happened to us because when I was asking from my university, when I joined Rajarata University, my boss told me, don't talk about cannabis, right? Because it is illegal in Sri Lanka. But it is a science, right? So there's a lot of science behind this. So we have to open Sri Lankan minds for not myth, but for the science, right? We lost actually cannabis. We are in connection for all other disciplines, economy, mathematics, ecology, right? Fisheries. We have a lot of connections with all other countries, right? But for cannabis, we have no connection between Sri Lanka and other countries. Although we have such a very nice history, a rich history, and 200 varieties of cannabis, right? And we are actually, I mean, this is not time to wait for 5 years.
There's some species of cannabis used to produce hemp fabric. It's a very comfortable fabric.
Yes. Yes. I have some shirts made of cannabis. I had a huge collection of cannabis from different countries, like 250 items, cosmetic, textiles, soap, beer, right, wines, paper, right, everything made of plastic, right? And I had a exhibition in Sri Lanka last April, right? I wanted to open a gallery to show people what cannabis can do, right? So then addict complained to the police, right? And the police came and arrested me and said that you can't do this, right? So this is where we are standing now, right?
Actually, we could invite Pupudu Sumana Sekara today. That was not in the back of my mind. I should have invited him because I think there is no war between the medical community and the people who do advocacy for cannabis. I think we shouldn't fight with each other. We shouldn't slander each other. Rather than fighting, we'll open a talk. We'll have this talk and we'll try to debate. I think that's how we can share ideas. So
Thank you,
there's
Ruwan,
a point that
organizing.
we are dealing with the pathological population.
Yeah.
It's true, but also we have seen how healthy people fall into the pit of
Benefits from
cannabis
that.
related.
Healthy people get more benefits.
Yeah, indeed. But same as some people can say that alcohol, it has certain values. Some people argue that, when I drink, I can work. When I drink, some creative people, some authors say that when I'm under the influence of alcohol, I can write songs, I can write poetry, I can write books. It's all individual. It's we can't generalize that. That's maybe the person is always creative. He had this creative ability inside him, and he smokes either cannabis or he takes alcohol. So we attribute that. So that's why we need to do a proper research. I'm so glad that our psychiatrist, Dr. Upali Peris, he highlighted a very important points, and also Wasantha. So thank you very much for bringing a lot of stuff. Actually, it was an eye-opener for me as well, because I was away from Sri Lanka for a number of years. So I didn't know what was really happening in Sri Lanka in the last few years. So it's indeed, I see your point. There are some valid points you highlighted. I think the medical community should listen to you and evaluate whatever the points you bring. Maybe there are plus points, there are some negative points, and there are some points could be harm to the society, harm to the mental health field. So I mean, that's why we said this is pros and cons of cannabis, and have this debate. So thank you very much for Wasantha and Dr. Peris and Dr. Manoj Fernando. Thank you very much for sending your thoughts. And I think we'll have another discussion. This time we'll try to bring some people from Addict, because I can speak to Pupudu. I have worked with him. He's a nice guy.
And invite also some smokers.
Yeah, we could do that. And if possible, we'll invite Snoop Dogg, who would talk about cannabis. Anyhow, before winding up, my profound thanks go to Nishanta. Thank you, Nishanta. You are the man. You are the one who saved the day. Thank you so much.
Thank you so much for organizing this type of discussion, Ruwan, Dr. Ruwan.
Okay, it's my pleasure. I think, I prefer this sort of discussions because it connects people, and people have different opinions. You should. I mean, I have my own opinion, and you have your opinion. It's okay. Still, it's okay to have different opinions. It's always good to have clashes. I mean, provided that we respect each other's the identity, and everybody has different specialties, because my specialty is psychology, and also I'm studying about post-traumatic stress disorder. So that's my passion. And I see how cannabis can
Yes, yes.
either adversely or positively or negatively affect my field. So I bring whatever the things that I was exposed to. So Wasantha brought what he was exposed to, and it's he pointed out very key points. I think the agriculture department should pay attention to him, and also to preserve these seeds, because eventually this is
It's
the
going to
fauna
be
and flora that
legalized.
we are going to lose it. Yeah,
Yes,
and
it's a
next time we
biodiversity.
can invite some some officers from the police department, the STF.
Yes, yeah.
So we'll do another broad discussion. So until
Yes.
such time, good night,
Good.
everybody.
Good
Thank you
night.
Good
so
night.
much.
Good night. Good
Night.
night.
Everyone. Wasantha.
Okay.
Interesting. Okay.